Welcome to Central News. My name is Tim Masemola, and today we are going to be talking to the MEC of Health in the Northwest Province, the Madoda Sambatha. Today we're going to be talking about the campaign, the sanitary campaign that they have launched in the province. They have went through a few towns, and he's the one who's going to be giving us more details. MEC, welcome to Central News. MEC.
Thank you very much, Tim, and your team.
Yes, MEC, we are aware that you have launched a sanitary towel campaign. Can you give us more details on the campaign?
Well, Tim, as the province of Northwest, the premier on the State of the Province address had spoken about giving access to young girls sanitary towels free. And if you will ask me why is that coming from, on the basis of the South African last research on access to sanitary towels, the research revealed that 7 million young girls in South Africa would miss the class the next day when their menstruation starts on the basis of non-availability of sanitary towels or inability to access them. As a province, we then decided that the Department of Health must extend its program of sanitary towels to cover up all young girls registered in institutions of higher learning in the province. As a result of that, we have started with the TVET colleges. The day of today was not the last one. The last one would be Vuselela, Taung, but we've gone to almost all of them, distributing them. What we do, we distribute on the day sanitary towels equal to 3-month sustainability. And that we are going to do this program permanently. And permanently means in each 3 months, they will get their supply for the next 3 months. When that ends, they get the supply for the next 3 months. That's what we are committed to. And it's on the basis of bringing dignity to our young girls in institutions of higher learning.
Are you only going to be targeting only institutions at higher learning, MEC?
Remember, there's 3 departments in Northwest that have that responsibility. There's high school learners. The responsibility rests with the Department of Education. Then there's members of community. The responsibility rests with social development. And in that instance, health too has a contribution to members of community who would then go to hospitals in that regard. So health is primarily focusing on general public access in health facilities, but also on institutions of higher learning. So the categories are covered, all of them.
Yes, but the question is, how did you come up to a conclusion that as the department, let us target the Department of Higher Learning? Because somebody might say, yes, they are targeting the Department of Higher Learning, but those who are in TVET colleges, they still get money, the NFSA's money, so it can maybe partly assist them.
No, that's not that's exactly why we are intervening on them. We don't want themselves to receive NSFAS and later have a deduction of a natural occurrence. Remember, menstruation is not like sex. Sex is optional. Menstruation is not optional on young girls. In actual fact, it is a component of building up to pregnancy. So we are taking off the pressure of either compromising money for transport or taking from your NSFAS. The state shall provide, we are providing for that, so that they use their NSFAS for something else that would contribute to their starting process. But beside that, here's the fact, 7 million in South Africa miss the next class on the basis that they have no access to sanitary towels. Once you are in a program of NSFAS, it therefore suggests that you are a state responsibility, because out of assessment, the reason you are given NSFAS is proven that you are from a family that cannot afford everything. So we are covering that gap.
Yes, MEC, one of our viewers from your province, I'm going to quote him, Lawrence. He's saying, "I like the initiative. It would be greater if it was launched in the rural or farm schools. Tibet colleges are better because already they have a way of getting sanitary pads." But at the same time, he's saying, well done to the Northwest Department of Health. But at the same time, MEC, what are you saying to the statement that he's making that the department could have maybe checked the farm schools?
There's two options there. A farm school, which is a high school, it's catered for by government provisions, by Department of Education. But in an instance, there is a special request for intervention. We will intervene even in those that are catered for by Department of Education as health. We will not stop. Here's the reality. We are government. On the basis of the increase on HIV and AIDS infections, we decided to have a program to provide condoms free. And like I said, sex is optional, yet menstrual period is not optional, it's nature. Whilst we provide for condoms free, we could not provide for young girls who had needed help on sanitary pads, and the province is doing that. So we have no problem to go to anyone who indicates the need, for as long that is within our program. But as I am saying, a farm school necessarily would be covered under Department of Education. But we were going to add an element that seeks to also go to farm schools so that we attend to rural young women who may not have access to a TVET, but would be based in a farm school. But those that are in the institutions of basic educations, not higher learning, they are covered under education.
Yes. MEC, let us come. You also mentioned the question that this campaign is going to be a permanent one. And we all know that with government, there will be hiccups there and there. How are you going to make sure that this campaign runs smoothly without unnecessary hiccups?
In fact, if you would have checked the pronouncement, this was covered in my budget speech in May. And in May, I said I'm going to launch it in August. From that time until now, preparations have been smooth. In fact, more than 40% of the sanitary pads we have distributed are a contribution of health delivery partners. We are joined in the program by Shout It Now, by Oram, by Right to Care. So we have a variety of stakeholders who have came with us and said, yes, MEC, we agree this is a necessary program. In fact, what we will do, this first distribution is done by the MEC. The next distribution is going to be done by management with managers of institutions of higher learning, but we are also conceptualizing a basis of creating a ballot box where students would have their secret codes to access their own share, which would be then stored, and then in 3 months' time, they could even be able to access another one. It's not an insurmountable task. It's a task we can afford. It's a task we want to ensure that young women, and in this program, we're not only focusing on sanitary pads, we're focusing on the whole element of adolescent, young, youth-friendly services, so that in institutions of higher learning, we again have health clinics, so that young students access there. If you can read a report on CTOP, CTOP is choice of termination of pregnancy. It has revealed that in institutions of higher learning, TVET colleges, young women are aborting choice of termination more than twice in a year, which means they fall pregnancy more than twice. That's why we link the program to the whole health campaign, including issues of STIs, including issues of HIV and AIDS.
In 3 minutes, your last words, MEC.
My last word is that the Department of Health is convinced on the necessity to come and help young girls to access in a province of Northwest, for the first time in South Africa, to access free sanitary towels provided for by the provincial government, not on the basis of who must get, but on the basis of all of them accessing irrespective of their capacity, for as long as they are in the institutions of higher learning. And we're doing this program on the basis of building focus on adolescents, young adolescent youth-friendly services for health services. Lastly, as you had said, we are a Department of Health. We call on all those in our province and in South Africa who are mocking anybody who falls in a category of the people who have who are suffering from the fact that anyone who has to have access to health should not be a person who's exposed. The element of exposure for people who are attending health services has to be protected. Health is a right of everybody. Young women must be helped and protected in terms of dignity, so that when they are through menstrual processes, they will not be ashamed of themselves. It's not a creation for them. It's what we have as nature. It's like albinism. Albinism, it's not a sickness. Albinism, it's not a process where people must be chased and being used by people who think that they can be used for mooties. It's not like that. Albinism is one of the conditions that our people are born with, and that everyone who is in the albinism process should not be attacked by our communities. We call for everybody to protect every human being, irrespective of the state a person is born with.
Yes. Before I let you go, MEC, maybe I should ask you this one. Are you also looking in terms of establishing a manufacturing plant of these sanitary towels, and also try to contribute in terms of job creation?
You are correct. You are correct. We also have raised a necessity to have a capacity to manufacture. And this capacity to manufacture is also going to help us first on the numbers, but secondly, on mitigation of the price. We necessarily are not happy with procurement of sanitary pads through a tender, because tenders are not sustainable in terms of availability. We're also looking into that, but we're exploring possibilities for that. Remember, there's a common component already in Shout It Now. There's a component of productions internally. We're thinking of mobilizing that capacity to ensure that all those of us who are prepared to be partnership with this program find a solution that is permanent in this instance. But we will never be venturing on manufacturing if it's going to be expensive than the current price. We need manufacturing on the basis of mitigating both price and availability.
Yes, you also spoke about the issue of urbanism, because I'm still going to go back to this one of manufacturing, but you also mentioned this one of albinism. Let's come back into our country. Remember, back in the years, people used to say a lot of things about people with albinism. As the department, do you have programs maybe to say, this is how we are going to educate people? Because our people previously, they had different ideas than now, even though our government is trying to educate our people. But remember where we come from.
Well, our program in health, it's an awareness that anyone in society should never be placed in danger of life on the basis of who that person is. But also in this element of albinism, we come in very handy on the arguments that albinism human beings are still seen to possess some elements that could be interpreted as healing. And as a result of that, the abuse on targeting them, it's sometimes argued either on the basis of the healing power they will get, but also on the basis of how others believe. We are saying to them, there is no medicine derived from killing another human being. There's no healing derived from killing another human being. Healing has to do with what we are provided with. So there must never be notions that motivate reasons upon which people living with albinism will end up being targets in society. That which you have, spare it, and let's ensure that we protect everybody and every human being.
Yes, MEC. Are people living with albinism get preference in your department?
Remember,
in terms of businesses and job opportunities?
In job opportunities, everybody is guided by the principle of employment equity. But in access to health, everybody is guided by what the Constitution prescribes. The people who have more preference, it's people who are disabled, it's people, it's elderly people on the basis of management of queues and access. You don't necessarily disintegrate people living with albinism as not equal to other people of society on access to health facilities. The only element that we are dealing with also is the issue of assistive devices. Assistive devices in this instance talks about wheelchairs, but it also talks about conditions of people. Remember, some of them have difficulty in surviving through a sun in terms of sunscreens, but also in terms of protection of their skin and also in terms of protection through eyesight. Those are the elements we're involved in. But in this instance, we then work with a provincial disability forum, which is instituted in the Premier's office.
Okay. MEC, thank you for your time.
Thank you very much, Tim. Thank you.
That was MEC for Health in the Northwest Province, and we talked about this program that they're embarking on, whereby they're distributing sanitary towels. Remember, he just spoke about that this program is not just for now, it's going to be happening permanently. So let's hope that this program will go, we'll continue monitoring it, and we'll get back to you and give you feedback.